lot of people come in and they just assume they don't have, oh, sorry if I just messed that up.
Me, I like how young you are. We're amazingly young.
So back to the question.
Yes.
That will be the next
Yes.
episode.
I like it. Yeah.
And you'll wear a point of view camera.
Yeah.
Oh, point of view.
POV.
When we
When
first
we first met, and she was being so loud. And I was so
And you were
stressed.
so
No.
Yes.
Order in the podcast.
Yeah.
I need a gavel. I've seen them there multiple times with the full regalia. And I want to say something like,
Oh, funny.
So it's right upstairs.
We weren't doing anything embarrassing, were we?
health and wellness is confusing. There's a new trend every week. Everyone's got an opinion, and half the time you can't tell what's legit from what's just good marketing. And we get it. We're in it too. Welcome to Dialed In Health. I'm Melissa Goodwin. Every episode, we bring in the people who actually do this work. Providers, practitioners, the experts who see clients and patients every day. We ask the questions you'd ask if you were sitting across from them so you can find the right people, make better decisions, and feel confident about what's out there. Whether it's peptides, gut health, water quality, ADHD, biohacking, or something you've never heard of, we're covering it. So let's get into it. Let's get dialed in. Most people walk into an audiology clinic saying, I can hear, but I just can't understand. And the hearing industry is trained to think of this as a device problem. But it's a brain problem, a body problem, and a timing problem. In today's episode, you'll learn what hearing changes happen during pregnancy and your childbearing years, and why a baseline test before symptoms changes everything, why hearing aids alone hit a wall, and the brain training program that fills that gap. My guests today are Melissa Baker and Dr. Libby Benson from Baker Audiology right here in Sioux Falls. And they have decades of clinical experience between them, and they're the only practice in the region offering structured LACE auditory training. So let's get into it. Welcome to the show.
Thank you.
Thank you. Thank you for having us.
Absolutely. Well, I'm excited because it's funny. My kids are always telling me, like, I think you need to get your hearing checked. And I don't know if I've just tuned them out.
Yes.
Or if I just hit too many concerts in my 20s, or maybe my ear, I don't know if I have my Peloton cranked too high, but
all of the above.
We might need to chat after this episode. I'd love to hear more about you guys, though. Tell me a little bit more about Baker Audiology, how you got into this practice, like what got you interested in hearing.
And how much do you want to know?
All of it.
Okay.
Tell us all of it.
Well, I'll start. So,
Okay.
I'm Melissa Baker, and I'm originally from Custer. I grew up there. I went to school down in Vermilion at the University of South Dakota.
The best school.
Of course, the best
Go Yotes.
school. Go Yotes. And then my husband and I moved to Indianapolis area, and we had two of our Hoosier kids, decided it was too hard, moved back. While I was there, I worked in nursing homes, assisted livings, hospitals. And then when I moved back here, I worked for private practice for 2 years. Then I worked at ENT for 5. And after that, I was like, oh, gosh, I can do this way better. So, and now we're voted local best.
Amazing.
I know, number 1 for
So
hearing aids.
What was it that you felt like you could do differently or better?
I feel like the patient experience is huge. And I feel like the way that people treat people is, I really wanted people to know that. I mean, I like to compare it to Disney World. When you go to Disney World, you just feel like, oh, it's amazing. I mean, obviously nobody's like, oh, yay, I get to get my hearing checked. It's like Disney World. No. But when you do, I wanted them to have that fun, exciting, like, okay, I'm important, feeling.
Yeah.
Absolutely.
So, Dr. Libby, Dr. Benson, what do you go by?
Whatever you want.
Okay, tell us what got you interested in hearing?
So I've always been interested in working with people with disabilities.
Okay.
When I was a younger person and a college student, I coached Special Olympics for several years and had a lot of fun doing that. But that was really born out of just like loving people and working with people and meeting interesting people. And then got into speech pathology, I thought I was going to do, and then that kind of morphed into where I took audiology classes and preferred that. Thought I wanted to work with kids, then started working with adults, really loved working with adults too. So yeah, but I feel like Melissa and I have a really shared vision for one thing that's lacking in all of healthcare is patient experience. In my opinion, just like being in other capacities and seeing how well people do and how their outcomes, like outcomes are so much better when people feel comfortable, they're enjoying themselves, and they feel positive about
also
it.
can be honest. Like,
Yeah.
you know, if they're not hearing,
Absolutely.
tell me.
Right.
Like, you gotta.
We want you to come back.
We want you to tell us.
We want you in our
We don't
office.
want hearing aids in the drawer.
Absolutely
So,
not.
yeah.
Yeah. And people have better outcomes. Like there's like even in VA where I used to work, the adoption rates aren't perfect there either where it's free. Right?
Sure.
Why is it even if it's free, some people don't want to wear their hearing aids, right? So we have a shared vision on
And also for
helping
people that
out.
are younger, like to get it checked before there's a problem. So we want people to feel comfortable doing that.
Well, your experience is interesting. I used your restroom a little bit ago, and there's like birds chirping in your bathroom. That's really fun.
It is fun.
It is.
And I saw there's a picture there, and I it's like a little bit of the Badlands, and I was like, I feel like I know that place. So I'm going to ask you if it is the right after you hit Phillip, right before you hit Wall. Is it right around there?
It is. Yeah.
Awesome. I don't know what
Yeah.
I win, but I feel like I just won something.
You did. We'll get you a
did.
prize.
You won.
You get it prize from the treasure chest.
We can give her the treasure chest.
All right,
the treasure
wonderful.
chest out.
That's amazing. Thank you. So one of the
Gosh,
things
it's
we
so
mentioned.
quiet now. I can't focus.
Yeah.
Sorry.
One of the things we mentioned is people come in and they say, I can hear, but I can't understand. What does that actually mean? What's happening when they say that?
Well, and that is true. They can hear, but they can't understand because they hear very good in the low pitch sounds.
Okay.
And that's usually the volume of speech or the vowels or some of the consonants like b, p, g. They hear those sounds fine. The sounds that they don't hear are like the TH sound, the F sound, and that's like 90% of the English language. So those low-pitched sounds start to overpower the high-pitched sounds, and it can sound like mumble or mush. So
Okay.
they hear people fine, can't quite understand what they say.
How this looks.
Yeah.
So like the word math, M-A-T-H. The M and the A, those are low pitch sounds. The
Okay.
TH is a very high pitch sound. So for someone who has high frequency hearing loss, they hear the word math, they have to guess. Did you say mask, map, mat, math? Right?
Got it.
Now in quiet, not a super hard guess. You can use context clues. But when more than one person's talking and you're in noise and it gets more complex.
And why that's important is because, say, like, you can figure it out,
Yeah.
but by then they're on to the next sentence.
Right.
So then that's when you're like, okay, well, forget it.
It just becomes too hard. Listening becomes too difficult. And that's why people
it's
just
hard for your
smile and
brain.
nod.
So does it change over? I'm imagining, obviously, as you get older, it's harder. So what happens sometimes in earlier years? So we talked a little bit about childbearing years and beyond. So obviously for women, but tell me, like, what is the journey like for women and men as they try to understand from this sounds of what you can hear?
Well, we have a patient, actually, this has happened to.
Okay.
I mean, there's quite a few people, but one I'm thinking of in particular, she's been a patient of mine for 10 years. And she's young. She's in her 30s. When you're pregnant, those kids suck everything out of you.
Right.
So,
Vampires.
I will say they are. And that includes, like, would you say it's like more of the deterioration of kind of the bones and, well, there's a lot of things. But
what
yeah.
we see is, any surge in hormone, particularly estrogen, either that's a surge high or a drop, right? So like pregnancy is going to be surging up. A drop is going to be like menopause. You're going to see, you can see consequences of that in the auditory system. Now, unfortunately, because in many things related to women and hormones, it's not well understood, right? There's different versions of hearing problems that can occur. So what Melissa's
She's 16
visiting
years
about,
younger than me, so she just was in school.
So
I
this is
can't
all
remember
book
this.
knowledge for you.
Yeah, exactly.
Well, and honestly, in the last 16 years since Melissa left school, it has
Here
been
we go.
It has been developing. We still
Sure.
don't know enough about this, right? We don't know enough about autoimmune conditions. We don't know enough about hormones. But
We do know that it's all linked.
Right.
You
Sure.
know, there's everything in your body's linked. I mean, your ears are attached to your head.
They
It's kind
are
of important.
Thank goodness for that.
Yeah.
So what
It'd
we
be
know
weird if we
about
were dragging them around behind us. That would be
Yes.
really awkward and hard to drive, do all kinds of
it
Yeah.
would
things.
be strange. That would
It
be a
would
whole
be
different problem.
so weird.
But what Melissa's
That would be a
talking,
SNL skit. Yeah.
You could do one of those maybe later
Yeah.
after this podcast.
Yeah, good idea.
But what Melissa's referring to, that is a hearing problem that can often occur in women of childbearing age, which
Sure.
is called otosclerosis. Otosclerosis is a little complicated because a genetic factor is very prominent in it. However, the reason why we often specifically see it around childbearing age is when you have that surge in estrogen during pregnancy, that's going to promote more of the bone growth. And the bones in your middle ear can become fused
I knew around
together.
the area.
So if those bones become fused together, then the sound can't be transmitted correctly. So like in the case of the patient that Melissa's referring to, she started wearing hearing aids shortly after she had her babies because, again,
And you know who I'm talking about.
I know exactly who you're talking about. And that's a common thing.
Okay.
Now, that condition can happen to men as well. It's not just, primarily hormone driven, but that can make it, if you had the genetic predisposition for that to happen to you, and then now you've had 3 babies in 6 years, it's going to accelerate that. As far as on the other side of things, though, like menopause and midlife, again, drop in estrogen can also have auditory consequences too,
And other things are factors. Medicine you take, noise exposure, genetics. For me, it's genetics. My grandma had hearing aids. My mom had hearing aids, has hearing aids, and guess who's next? I mean, I already have tinnitus, constant tinnitus.
Is that how you say it? Tinnitus?
Tomato, tinnitus,
Yeah.
but it is
If you want to be
tinnitus.
correct.
If you want to
it's
be
tinnitus.
correct.
Definitely
tinnitus.
not tendinitis.
Yeah, I mean, I didn't go to Harvard or anything.
Oh,
True.
true.
And
We
I'm
did
not
take
an
a class
attorney.
at Harvard. We did a tinnitus class at Harvard.
We did.
Was it
actually.
really?
I have a
Yes.
T-shirt.
Yes, we did.
So now you've heard it here first. It's tinnitus.
Harvard trained.
Harvard trained.
Harvard, oh, yeah. Harvard
tinnitus.
trained. Oh, whoops. I thought you meant our fame. Okay.
So the hearing loss how would you know that it's not just something like, that's going to pass? Like viral things can cause hearing loss, especially when you're young. Like you're just like, oh, this is something weird's going on. I got a ringing in my ears. Like when do I know that it's actually something serious? I should.
What I do wish is people would treat it like they do their eyes.
Okay.
If you had something happen with one of your eyes, you
Especially
would
sudden.
call right away and be like, oh man, all of a sudden I can't see. You would do something about it right away. Same thing with ears, because there are treatments. We can get your hearing back, get rid of the tinnitus. So if they were to get a hearing test right away, we would be able to refer you to the right people.
Okay. So why do you think people wait? Why do you think they're just like, oh, hearing, it's not that big of a deal? Why do you think people are just so hesitant?
I think it has a lot to do with, I can get by or it'll work itself out.
They don't want to get a hearing aid too.
Okay.
Then maybe they're scared somebody's going to say that. But we might say, hey, you need an MRI. Or
Sure.
you need to get on prednisone. Or,
Or your ears are impacted with earwax.
exactly.
Easy
It could
fixes.
be earwax. We've had a lot of people that like, oh my gosh, I can't hear, and then it's earwax. So
Speaking of earwax, Q-tips. Tell me how you feel about that.
dun dun.
We'll get a little
Q-tips are
closer.
tricky because there are
Lean
some
in.
people who use Q-tips who will never have a problem. But for many who use it, they think they're cleaning their ears and they're just shoving it deeper.
Okay.
And I've actually checked it too. I've actually done it to show them, and then videotaped it. And it's
Like a
way
before and
deeper.
after.
Yeah.
Yeah.
Okay.
Yeah, thank you.
Yeah.
So it's not.
I couldn't get those words.
So I grew up. That's what we did. That's how you know your
Yeah.
ears were clean in the morning. So I guess I should
And
stop
also a
doing that.
bobby pin. We always
Oh,
hear
that's
people
a
saying
terrible
that,
idea.
Yeah.
Oh,
But
that
I've had
sounds
a
worse.
patient do it their entire life, and then they randomly one day accidentally perforated their eardrum. And they were like, "I cannot believe I did that."
And also ear candling. I've had a young girl do the ear candling. The wax dripped on her eardrum, and she was going to get surgery to get it off.
So all these crunchy groups that I've seen, like they really love the ear candling. Do you ever
do
get in
it.
those groups?
You
Do you ever get in those groups and just like rage type, like stop it?
Well, it's kind
Actual
of like your job.
audiologist
I
here.
don't know if you listen to Do you listen to podcasts?
I
Since You
do.
do a
So,
podcast.
yeah.
You do. Well, it's kind of like
I've
when
heard one.
patients
I've
tell
heard one
us,
podcast before.
Yeah, I know. Right. But see, this is our job. I feel like when patients say, oh my gosh, you got to watch this movie. It's about tinnitus. And I'm like, maybe not. Like on my free time,
Well,
you
and
know.
Melissa's looking at the ads. She's
Yeah,
getting the targeted
I'm
ads.
too busy buying things.
She is too busy
I
in the
mean,
targeted ads on social media to ever
Actually,
be in a group.
love these new shoes. Just kidding.
Okay, back to the matter at
sorry.
hand. So tell us about, you said otosclerosis. What does that mean exactly? What is happening? And how do I know if my family has it or if I have it?
So otosclerosis has a strong genetic component. So,
Actually, kind of like what she just talked about too, with the hormones and the bones.
Okay.
yeah,
Yep.
yeah. So what I was describing was otosclerosis. It's literally the bones inside of your ear are having abnormal formation.
Okay.
And what can happen is they can get basically fixed, stuck, where they don't move and transmit sound like this anymore. They just get stuck, and then now you're
So
going to
when
have a hearing
sound comes
loss
through, it goes
associated
to
with
the eardrum, then to the bones in the middle ear, then to the inner ear. So those bones in the middle ear can get stuck.
I don't think of
So-
my ear having bones.
smallest
Yeah.
bones in your body.
Yeah.
I don't
like
realize
the
that.
stapes or stirrup, some people say.
Okay.
Yeah.
You have bones in your ears. I guess
Smallest bones in your body. They can fit on the head of a penny.
Okay. That's interesting to know, and be careful with them.
Well, and the hard part about it is there's really nothing you can
Yes.
do. It's it's if you have the right circumstances genetically and hormone fluctuations and all the things, it's going to be something that
They
just
just
happens.
fuse and you're done.
Right. The good news is though is that's an easy hearing loss to treat in the fact
Okay.
that it sounds really good for them.
Right.
Sound
Okay.
will sound really good for people like that because their cells in the inner ear are
And
not
there's possible
impacted.
surgery. So some of these hearing losses can be fixed. So
That's
it's really
really
sad when people don't get a baseline. I mean, it's so nice when they get a baseline because then we know where their hearing was
Okay.
and what is happening right away. So then same thing with your eyes. You get your eyes checked.
Yeah, you're
You know?
supposed to.
Look, I'm like mad. You get your eyes checked. Get your ears checked, people.
Yeah, get your ears
Well, and
checked.
think about it, like
Well,
it-
I think I did it in school.
Sorry, I have red hair. Sometimes
Yeah.
that happens.
Well, they do it in school, like elementary, and I think that's the last time most of us get our ears checked until something goes
Yeah.
wrong, right?
Well, and think about it. Like, say you wake up one day and you can't hear, right? If we don't know where your baseline was, we don't know how much deterioration you've had, right? If you had an exam even 2 years ago and now you woke
thought
up
you were
and you have
looking
this
at
huge hearing loss, that's way more than 2 years of aging, right? This
Okay.
is serious. We need to get you to refer.
But if it's like 5 decibels, that's normal deviation. So it's like, well, you've only lost 5 decibels
Right.
from last year.
Okay.
Absolutely. It's how we
So-
determine that if it's an emergency or
Or
not.
a lot of times people will come in with their hearing aids and say, oh, my hearing's way worse. So then we'll check it and we've already matched their tinnitus. So then we'll know. And really, it's actually their hearing aids just need cleaned.
So it's not necessarily what's normal. It's we all have different capacity for hearing. Is that true? Is that like
Yeah.
a true statement?
Yeah, I mean, like genetically, for sure. Some people
So I
hear
might
at
hear
negative
something-
20. And so when you have a 20 decibel loss, you hear at 0, well, that's a major hearing loss for you.
Sure.
But we don't know that unless you get a baseline. So, yeah.
So how do I know if I'm really good at hearing?
well, why
It's
aren't we
kinda
going
like
in and
20
doing an
yeah,
exam,
let-
Melissa?
Actually,
Let's get in the booth.
Let's all go to the booth. That will be the next episode.
I like it. Yeah.
And you'll wear a point of view camera.
Yeah.
Oh, point of view.
POV.
Is that
be
Law and Order
fun.
too? Do they wear those? Or
Dun,
like chest cam?
Yes.
Body cam.
Body cam. I
Orders.
like that. Objection.
Yes, absolutely. Please.
Is it plaintiff or bailiff?
Bailiff
or do you
is
say
the
both?
cop. Plaintiff is the guy.
Oh, of
that
course she
is
knows.
the person
She's
that's-
watched every show.
Okay. So
Order.
order in the podcast.
Yeah.
I need a gavel.
You do need a gavel.
Order in the podcast. Tell me now. So you some people are really good at hearing. Then so if are there professions that if I'm really good at it, or if somebody that's
Yes.
not so good at it, how
A
would you know?
diver. Just kidding.
Well,
I'm
I would
teasing.
say, now most people when they're born have normal hearing, right? Normal hearing is, 0 to 20 decibels.
Okay.
When you start getting to, poorer than 20 decibels, that's when speech is going to be impacted.
Okay.
And I even think that at our Harvard tinnitus class, they said that after 10 decibels for an adult.
is when you'd start to notice
Right.
ringing potentially.
Yes.
Yes.
And are we
You
talking like
have to right
logarithmic
there.
scales here? Does it get? Are we going to have to math?
No. So
Okay.
hearing is converted. It is a logarithmic scale, like
Well, it
sound
is
pressure
yeah.
level is, but we convert it into HL so that it's easy for a layman to read it.
Okay.
Yeah.
HL. At least thank you for putting it into
Yeah.
And that
HL.
means hearing level.
Yeah. So like when we
I do
explain
know
it
that.
to you, we take the logarithmic stuff out of the equation.
and you tell me
I
like
mean, I could tell you all the logarithmic stuff
Yeah.
if you want.
but the HL is what?
it just means hearing level.
Hearing level. So
Yeah.
what's a good level?
So I mean, like
0 to 20.
0 to 20.
I mean, you
around
want
10.
to be 0 to 10.
Okay,
Right.
got it.
Yeah.
Okay.
I mean, negative 20 is really good. Or negative 40. Should I keep going?
Yeah.
Negative 60. Oh my gosh.
Really good.
Amaze.
So tell me about insurance. Let's talk about the insurance bugger.
Now you're going to trigger Melissa. She's going to get really angry and aggressive right now.
Why? I don't
Order.
even know that.
Order.
Like, I
remember
don't
our
even like
taxes
insurance.
thing. She hates it.
What is
No.
insurance?
What is insurance?
Like,
Insurance.
what
I don't
is
even like
insurance?
insurance.
So I will tell
Do you know
you.
what's that from?
I don't need
Yeah,
insurance
I
because
don't even like
I already had it
insurance.
like 10 years ago, and
I
I
am
don't need to buy it
insurance.
I
again.
am insurance.
I am Blue Cross Blue
I
Shield.
invented insurance.
My name is Anthem.
I'm Cigna.
As long as you're not
Blue Cross
Humana.
Blue Shield.
Yeah,
So I will
Blue Cross,
say,
that's
in
better,
our
yeah.
industry, there are many providers
look.
who do not accept
all-
insurance.
yeah.
There are
Okay.
many people who don't because it's hard. It is hard, but we do it for our patients because it's going to benefit them.
And then we do all of the work.
We do all of the work, and it's
Yes.
a lot of work.
And so even take, for example, we had a patient, it took a year and a half.
to get us to get paid. Yes.
But he didn't know that. And
Sure.
that's okay. That's
Yeah,
good.
It's about
That's
the
what we want.
experience. Yes. And we also really
He got
like
to ride the Dumbo ride.
He got
And
to
he was
listen to the
great.
birds in the bathroom.
Birds in the
Right.
bathroom.
Got
He didn't
something
know.
out of
Yep.
the treasure chest.
Yeah,
Went on his merry way. Maybe went to great life.
exactly. He did.
That's another thing too, though, is like some people come
Oh, I
in
thought
and
you
they
were
don't
going to say
know.
that's another thing. You
They
can
don't
go to
know.
Right Life right
Yeah,
next.
you could get a gym
Membership.
and
We
it's
give up.
$19.99 a month.
This is really,
Sponsored by.
this is probably the most ADD episode we've had yet.
Oh,
but
yeah.
I love
Sorry,
it.
I can't
This
help
is
You
very
need
fun.
to actually. The next episode needs to be you get an ADHD specialist intervention with us.
I have one.
Oh, you
Yeah,
do?
please.
Actually?
I do.
And
coming
just
up.
think we're both medicated.
Yeah, this
Highly-
is
this
a
is
watered down
medicated.
version. Scary.
Wait till the end of the day. Then we're like
Oh,
just
it's a
staring
zoo.
off into
It's so strange.
where I'm like off the walls and Libby's like looking at butterflies. It's bad.
Yeah,
no, I'm
it's very
teasing.
bad. But what were we
Insurance.
talking about? Oh, insurance.
Oh, insurance, yeah.
Okay, so a lot of people come in and just assume that they don't have coverage, or
And
you
I'm
know,
sometimes surprised.
and I am surprised often. You know,
Okay.
now I wouldn't say it's like super common. Many people are private pay, but there are more
There's
people.
a lot of people that have insurance
There
coverage.
are. We have a lot
Okay.
of. I've been shocked in that too.
Yeah.
And we're pretty good. Like we like to fight for our people. Like our people are family. Like we love our patients. We're so
Mm-hmm. Yeah.
lucky
Yeah,
to
we
serve
are.
such wonderful people in Sioux Falls. Like I have
So
friends.
if you're a jerk, don't come here. No, I'm teasing.
Right.
Go to the other place.
Yes.
But like I have friends who they work in like
Terrible.
Seattle.
No,
or,
we
you
like
know,
the jerks too.
and they
We like
they complain
everybody.
about all these awful people. Like our public here is wonderful. I mean, we have the coolest, best, most kindest patients.
We do.
And so we like to fight for our people.
And I think they're kind to us because they know how we treat them.
Yeah.
Yeah,
too.
like we'd do anything for our people. So we like to just get that insurance covered and write the
Oh,
letter.
man.
We do our
Write the
aggressive,
letter.
aggressive typing.
And then I call them and yell
And they
at
reject it, and you have to appeal.
Right.
They
Yeah, but
reject
then
it,
when
and you
you-
have to appeal.
when you
But
figure
that's
out
also
how
why
to
we
do it,
also
though.
hired another insurance company too to help
Oh,
us. So
yeah.
yeah.
We're pretty good at it now.
Well, you are. I don't know what NBA.
ABN.
ABN, okay.
Okay.
So we're pretty good at it now where but
We
we
know what's
accept them
going
all
on.
because we want to help people. We don't want to have to turn people away.
Quick break. This episode is brought to you by Vitality Growth Labs. If you're a health or wellness practice and you're wondering why your phone isn't ringing the way it should be, Vitality Growth Labs builds the systems to fix that. Get found, build trust, fill your calendar. AI authority stacking, videos that connect with your clients, real tools, strategy, and execution that results in real revenue. Visit vitalitygrowthlabs.com or check the provider directory at vitalitygrowthlabs.com/the directory to find a trusted wellness provider near you. All right, back to the show.
And so can you even get your baseline covered?
Medicare
yeah.
is going to
Okay.
cover the cost of an exam for almost everybody.
And say like
That's
it
on
wouldn't.
Medicare.
We would help you out.
Okay.
I mean, I'm not going to worry about $20. You know.
Okay.
Okay, maybe we should not advertise that.
Cut.
But I will say though,
I'll take that $20.
Yeah.
we are
Go
very
to Great Life and get a membership for a month.
Exactly.
We're very
Wear your
understanding though. I mean, like our patients, we just want them to do well. You know,
Yes.
we've got a lady who pays us in pie. It's fine.
In pie.
She
Literally
pie.
does.
Well, we trade. So I clean her hearing aids. She has a pie business. It's amazing and worth it.
Like we get excited when she comes.
I'm like
Yeah.
so excited. I'm like, yeah, she's coming today.
Pie
so
is
shout
one of
out.
those things you don't like make a pie. People don't make pie
No.
anymore. Like
Especially
Oh my
not
god!
work.
It's not just pie.
It's so
really
good.
good.
We'll give you her
First,
card.
I found her
Yeah.
on social media ads.
Okay.
Targeted pie
Blueberry
ads.
pie. I
Yeah.
did. Sour cream raisin. My grandma's used to make all these crazy
Yeah.
pies. I never, like, who buys pies? We should start.
We do.
Well, now everyone's
We
going
get
to
'em
start
gifted.
buying pies.
Yeah.
We'll put a link into the show notes to buy her pies.
But you
yes.
know, I say
She's
that as
so
an
good.
example because again, like we're so lucky living in the community we do that like the people who can pay their bills
Yeah.
so that we can help people in scenarios where it is really a bad situation and they
Right.
need help. We're able to do that, which
Yeah.
is one of the best parts about being private. We can do whatever we want.
Isn't that great?
So great.
It's also
We
terrifying.
can wear
You're
shoes
like, wait,
without.
you're going to let me do whatever I want? Then you're like, wait, oh my gosh, what do I do?
right.
Yes.
So that
Right.
there can be a little bit of that.
Guess
All
I
right.
shouldn't
So
talk
tell
about my
me
shoes.
when somebody gets a standard hearing test, what does a standard hearing test miss? So like if you have all the kids line up, they put the earphones on, you raise your hand, then they're like, all right, next, and you kind of move on. What is happening or what's getting missed in those typical scenarios?
Well, you're describing a screener.
Okay.
Screener is a little different than a diagnostic test.
And
Okay.
and it's very loud and noisy. So it's okay if your kid fails the test. Just, we always do the follow-up test, and most of the time it's fine.
Okay.
But, if it's not, then we can figure it out right away. So, because again, that's about, your ears are attached to your head. Your head is learning. And if you're not getting the information, well, then you're suffering.
Sure.
Suffering.
And so,
that's
like,
not the right
basically, the
word.
biggest difference is, like, when you're, like, say you just remember what it was like when you were a kid.
Which was a while ago. I mean, it's a little.
Oh, don't
You know.
let her, don't say that to her. She'll
Maybe 5
say
minutes
how,
ago.
how old we are.
So, what's different about it, though, is it's just
Depends on who you
expanded
ask.
upon.
Yeah. I think
right.
you're pretty young. If you ask me, I like how young you are. We're amazingly young.
So, back to the question.
Yes. If you do
no.
remember.
So, yeah,
was a while ago,
You know,
but yes.
it's similar, but it's just much more thorough.
Okay.
We're going to be doing additional things. We're going to be doing speech testing. We're going to be doing eardrum function testing.
I've even done tinnitus matching on kids because then we'll talk about it and they're like, oh,
But
yeah,
you're
I
not-
hear that sound.
You're not asking specifically about kids. You're just saying, like, what's different
anyone.
about it.
Yeah,
right?
so like a standard, what does a standard test often miss?
Right.
yeah,
You mean,
sure.
like, what is a screener miss versus
Sure.
a regular test?
ADD kicked in. I missed
Yeah.
that part. But yeah, like the
This
tinnitus.
is like an ADD party right
Oh,
here.
man.
Oh,
It's a-
we love it.
Yeah, so
So
Back
yes,
to
you're
you.
going to the things that it's going to miss is you're not going to address tinnitus at all. In a
Okay.
screening
that's why we
exam.
have to be so loud. We have to shout over each other.
So you're going to miss you're not even addressing tinnitus in an exam like that. You're not addressing middle ear function at
Yeah.
all. So if you had something like
Fluid,
ear infection,
infection,
otosclerosis,
eustachian,
medical
tube
problems,
dysfunction.
Yep.
that's more of a pass-fail type screeners are, where this is a full diagnostic exam.
acoustic neuroma. I just started
She's just
naming all the
listing
So I have a
problems.
question. Like, is it normal, like every once in a while, where all of a sudden it's like, bleep, like you hear like this weird sound in your ear, and then it kind of goes away, and you don't like you forget about it, and like maybe 3 or 4 years later, it happens again, like the random stuff.
And that's pretty normal.
What is
Everybody
that?
does get some just
Random
intermittent
tinnitus.
tinnitus.
Yeah.
Okay.
Really,
That-
it's usually your hair cells are starting to be damaged, and they're kind
Okay.
of just going, help me.
And now I actually do have like a very quiet, constant tinnitus that I hear all
Ooh.
the time. I know. But
That's
hearing
hard.
aids are the only true treatment to it.
Okay, and that
So-
helps it.
It does.
Okay.
It helps mask it because then your brain is hearing real sound.
Okay. Because that happened to one of my kids the other day, and she was like so scared, and I was like, it'll be fine. But that, I didn't. I mean,
Yeah,
Again, it will be
I would say
fine.
if it
Or
becomes,
will
it?
it?
depends
I
on
don't
the
know.
duration.
kidding.
Like if it's just a one-off thing, there's a lot of things that can cause that. TMJ can cause
And
it.
earwax.
Earwax.
Sure. Okay.
Inflammation. Not drinking enough water. a lot
But in
of
the
those
cases
things.
where it doesn't go away, like in a day and it keeps doing that, that is
yeah.
for sure when you say, okay, let's go get it checked right away.
and then people would get that from COVID too.
Right? Yep.
So did they come and see you after they get COVID, and you're like, oh, this is like a long COVID symptom? Do you have to get hearing aids?
Most of the time when people have
Well,
tinnitus,
I've had that. I actually had that happen to me.
You
I
did?
had- yes. I had tinnitus and I had hearing loss in my one ear from COVID. When we first met,
and she was being so
loud.
loud,
I was,
and I was so
and you were
nervous.
so sweaty.
No.
Yes. I was like, no.
Did it go away?
Well, I actually got on prednisone right away. Yes,
Okay.
I did.
So an antibiotic.
So
Steroid.
not, I
Steroid.
didn't actually, steroid because it helps with the inflammation. And
Okay.
Yeah, so then it did go away.
That did kick
So-
in. Okay.
But again, I got on it right away. So if you wait like 3 weeks, it might not.
Tell me a story of maybe someone who waited a little too long and you're like, ooh.
Unfortunately, a lot of the
Everybody.
people we see wait too long.
Okay.
So then, yes, then the next step would be possible hearing aids because
You're
it
not going to
didn't go
recover
away.
it. Yeah.
Right.
And most people who think they just have tinnitus, most people, they also have some degree of hearing loss.
Right.
That they're just not, the tinnitus is more
Cart
bothersome
before
to
the
them.
horse. What's the saying? Yeah, you know what I'm saying.
Horses
The
in
horse-
water.
Horse, the cart
Get back
before
on the horse. I'm going to go all kinds of places.
Save a
with this
horse,
one.
ride a cowboy.
Don't shoot a dead horse, or what is that one?
beat a dead horse. Yeah.
Yeah.
Yes.
So,
Yeah.
well,
All of those
anyway, I'm
things.
saying that like the tinnitus can come and then the hearing loss, or the hearing loss, then the tinnitus.
Okay.
That's what I meant by that saying.
So unfortunately, like in that case, if you don't intervene fast enough, you're never going to recover it.
Okay.
Where if you can get first 72 hours, ideally first 36 hours.
Yes.
I mean, your chances of recovery are so
So if
much
that
higher.
happens, that is the only real ear emergency.
You lose your hearing.
and you're
Lose
not
your
getting
hearing,
it back.
or you have that ringing that does not go away.
And it's
Okay.
sudden onset. You know,
That
like-
is when you need to for sure do something.
Okay.
It's
And
not necessarily we're going to say you need a hearing aid. So
Okay.
you don't need to be worried about that.
so if you do lose your hearing, you wake up and you can't like get an appointment right away. Can they get in with
Absolutely.
you?
Yes.
If that's
Oh,
an
if they
emergency?
say those
if
words,
they say
they will
those
get in.
words, I
Okay.
have sudden hearing loss,
We
sudden
make room.
tinnitus, we make room.
and the physicians that we work with who prescribe
Also
the
make
steroids,
room.
they also make
They know
room.
that.
And if
too.
they don't make room, we don't work with them.
Yeah,
Okay.
That's
they will make room.
Just kidding.
So watch
They-
out.
Yeah, watch out. No, but they usually all of them make room.
Yeah, they know the severity of it too and the
Yeah.
time sensitivity of it.
Okay. Tell me about lace. What is lace?
So I'm going to have her do most of the explaining. She's already giggling at me. But to put it very simply, since I'm old, it is ear-brain training to help you when you go in background noise to help you hear better. Just like exercise on anything. If
Okay.
you want to get better at something, you have to practice.
Okay.
Go ahead, Libby.
And I always laugh because this is classic Melissa Libby dynamic. Melissa goes head
now
first.
I went like this.
She goes head first. She's like, "We're doing lace. We're doing it." And this is the thing that works about us. Melissa is fearless. She will do something. She goes all in, which is awesome.
Can
I'm
we
probably
say the big ball thing?
she's
Yeah.
got very big balls.
I got big balls.
That's right.
But
I like
you know,
it.
she'll take chances. I'm probably more
of
reluctant
an
on that.
extremist.
However, then I'll go do all the
Somebody's gotta
research
execute.
and
Oh yeah, I got the dream, and then she'll
And I'll do all the
I'm
research
Walt
and learn
Disney,
all the
she's
things.
Roy Disney. Well, she hates music.
well, because I'm pretty sure one of them's a pedophile.
Which one?
I don't want to be
Who
the
are you
pedophile
talking about?
one.
Batman
Walt
and
and
Robin?
Roy Disney.
brothers.
Oh, got it. I don't know
Walt
that.
had all the ideas. Roy executed
yeah, and then
it,
she,
I think.
you know, so
Yeah,
that's how.
So,
But she doesn't like me
Maybe
calling her
there's
that because she's
maybe
not
there's
a
a Batman and
pedophile.
Robin or something. But
Yes,
Yeah.
well, they
But Robin's
probably
kind of
were.
second
Yeah.
fiddle, so you don't like that one.
Yeah,
There's got to
I
be like a
know.
good Thelma and Louise.
ooh,
What about that?
True,
I mean, don't get a convertible or anything anytime soon.
That's got
But
true. I might.
I mean,
But she'd have to execute it, make sure we had the money. So anyway, go on.
Okay,
So,
so
what
anyway.
happens is I was like, oh yeah, let's do lace. This is amazing. We want to do it. But then I don't learn anything about it. And then she has to learn it and figure it out and see how we sign people up. And
and it works really good though. I mean, like
It
again,
works
I'm
good.
glad you took the chance because it's benefited our patients tremendously.
what is it?
So what it is it's an it's an auditory
we're not
training
going to go into
program.
that, okay?
So it's an
We're
auditory.
so glad we did it, and we have big balls. That's all you need to know.
Yes, that's all Melissa cares about is balls.
Okay, next question.
So,
Just
but what
kidding.
LACE is it's an auditory training program that it is preparing you so that when you get to a situation that is complex listening, so background noise specifically,
Okay.
you are prepared to perform better. So we saw this problem where we had patients who had very good hearing aids. We knew they were programmed correctly. They were getting the most they could out of their devices, and they were still having trouble in background noise. Now, what makes a premium hearing aid more expensive is the background noise reduction, right? That
Okay.
is what sets it apart. Cost for hearing aids, you are paying for background noise reduction. So, you know,
It's
these...
kind of like looking at a TV. One, they might be the same size, look the same on the outside, but one has better pixels, sounds better, faster, has more
Okay.
features.
Superior technology.
Right.
So even people, we had a group of people who, even with the best hearing aid on the market, programmed perfectly to their hearing loss, they were still struggling with background noise, right? Because it takes complex listening skills to be able to do this. What LACE does is it bridges the gap. The hearing aid helps the sound get to the brain. LACE trains your brain what to do with the sound. How to integrate it so that you can listen and hear better in complex listening situations.
And you can practice this in your home. You don't go out in public. It's an app. I think. I haven't even looked. I mean, I told her that I wanted to do it. And so back to you, Libby.
No, it is an app. And don't let Melissa fool you. She does actually know what it is. But it is an app-based program. But exactly right. Like our patients would say, I shy away from going to the restaurant because I know I'm going to struggle there. Well, this is practice before you get to the restaurant so that when you get there, you can perform in background noise.
And actually, and again, I don't know the exact number she does, but it's like 70, 80% improvement.
Oh, wow. So
Significant improvement.
how are you training your
Do you
brain?
know what it is?
What is the app
It's like
teaching you to do?
60,
Like if I had the app
70.
in front of me right now, what would it be saying?
6, 7.
So there's four
60,
different
70 improvement.
So there's 4 different parts of your
That was a
brain that
good
it
one.
targets, and it's targeting 4 different things that you need to hear well in background noise. It is all app-based, though. So basically,
Okay.
you have a person that is your teacher that's going to guide you through your program, and your program is exercising those 4 different parts of your brain needed to hear well in background noise. It also has like built-in assessments where it assesses how well you're doing. I've had patients who are in their 90s who have a cochlear implant. They're in a very severe case of hearing loss, who their score starts at severe impairment in noise, and they get to mild. I mean, that's a huge, quality of life altering change.
They can actually participate.
Right. And
So-
before they were like, oh my
And
gosh,
their
I thought I
families
was.
are even crying because they're like,
Yeah. Or
happy.
the
Oh,
husband
wow.
does it for 6 weeks, and then his wife is coming in and is like, I want to do this too. Like, he's doing amazing. So it's really bridging
and
that
we're the
gap.
only audiologists in South Dakota
So why
to
is
do
that?
this.
I mean, it's a cost investment.
Okay.
That's why.
The training.
I don't
You
know.
know?
I don't
I
even
mean,
know
like,
that.
it's not.
Just kidding.
It's a cost investment. Now
Cost
we
something?
have it where we
I
want
thought it
all
was
of our
free.
patients to do it. So for our patients,
I just said we're doing it, and then she took over.
Then she'd write the check.
yeah. So
Exactly, perfect.
a lot of people it's going to raise your cost of doing business, so
Okay.
they don't want to. We wanted to invest in it. I mean, we wanted our patients
We
to
care about people.
We want our patients to perform the best. That if they come here, they're going to perform better than they
Anywhere.
could anywhere else.
Okay. So
And again, that's why we won local best.
yeah, I see that. You've
Yep.
got all kinds of awards here on the counter.
Yeah.
So tell me, why do you think people are so hesitant to get hearing aids? What is so scary
I think
about
it's
it?
just the stigma that has always been. So they're actually getting quite cool now. So
Cool, yeah.
yes, some hearing aids even have where it tracks your steps
Okay.
and your exercise.
Translate languages.
Right.
Oh.
Transcribes. So say
track.
like you wanted closed caption on and nobody else did, it will do that.
Oh,
for you.
wow.
Yeah.
It can track your respiratory rate. Some of the devices can.
Yeah.
Very cool.
So
I
there's
mean,
some cool features
Bluetooth
in them.
streaming.
Obviously, that's not the most important. Now, some hearing aids also can actually, again, all the bells and whistles and terms will refer to Libby. But some of the hearing aids can actually reverse some of the noise, and it is quite amazing how some of them you can
Wow.
hear noise.
Maybe if
Sorry.
there's one that has
Darn.
a translator for teenage language or
like
current
slang.
where they're
Yes.
that's cooked, and I'm like, is this good or bad?
Well, you mean
know,
that's
cut-
mid.
No cap.
No, yeah. What is that? Is cooked good?
Is mid?
I think
Low,
that's no.
totally
cap.
low key.
Yeah.
No cap. That's what I just say.
So you probably have one in right now telling you what that
Oh yeah,
means.
I just knew what you were saying.
Anyway.
And we can get hearing aids that people do not see. So there's little tiny ones. I think there's just so many stigmas about why you don't want to do hearing. I mean,
Do you have to
don't get me
charge
wrong.
it? Do you have to
Yeah,
plug it
there's
in?
they're rechargeable.
Okay.
Yep. And
So-
Bluetooth.
How long do they last? For
Are
you
you
to
talking
charge
about
it?
in hours of the day?
Yeah.
Depending on the model, at least all day. So 20
20
hours. But
20
there's
hours,
some
some
models that are 48
50.
or 51.
Okay.
Yeah.
Or 51. Okay, I like the specificity. That's good.
It's actually 52. How annoying. It is actually.
All right, I'm going to
So you
read.
know I'm right. One time.
I'm going to read a couple of statements, and
Right
you
click.
tell me if this is true or false. I'm too young to need a hearing test.
False. Big fat false.
What age should you get a hearing test? When should we start getting them?
Well,
I mean, I think that your kids should get them. So I think you should get one at least, if you have a normal test, every 3 years for sure.
everyone should have a
Everybody
baseline,
should.
no matter what, just for your health. You know, there are some certain medications that ototoxicity is of concern, meaning those medications can impact hearing loss and tinnitus. Say you have an exam and, you know, God forbid you had a cancer treatment you were starting, right? If we got a new exam after you started those treatments and we compared the two, that might tell us we need to back off on that chemo drug. It's
Or
way
we need
too
to
strong.
switch it.
Or we need to switch it.
Or the doctors would know what to do.
Okay.
It tells you a lot about your health. Your hearing can tell you a lot about your health overall. So everyone should at least have one baseline exam, no matter
Okay.
what your age is.
I mean,
So book your
at least
baseline.
in your 20s,
Okay.
I'll say.
Now, when you get to closer to where age-related hearing loss starts to show up, you know, like 50 plus,
Oh, is that what
every
it
year, I would recommend.
Is that when
I
it
mean, I
shows
probably
up?
need a hearing aid. I'm 45. Well, wait, no, I'm not. I'm 46.
Yeah.
Can't even
Can't remember.
Can't remember.
Getting
Somewhere
the
around there.
dementia. I need hearing aids.
Okay. Pregnancy ringing. Maybe just wait it out.
False.
False.
False. There are some cases of hearing loss and ringing that show up in pregnancy that are temporary.
Okay.
That is sometimes the case, but you don't ever want to risk it. If you have any concerns, get it checked out.
Yep, just like what we've been saying.
Hearing
If you
aids,
haven't heard us this whole time,
come in
kidding.
and get a baseline.
Yes.
Hearing aids fix the problem.
They're
That's
a
loaded.
corrector. Hearing aids are a corrector. They're not, or they're an aid. They're not like glasses. They don't make your eyes back to 20/20 again. They're an aid. So
Okay.
they don't totally correct it, but they do help in the situations. Yeah.
There is not a cure for hearing loss or tinnitus. There are treatments that we can do to make it as best as we possibly can. Some cases we can get very close to normal hearing. Some
Okay.
cases we can. Other cases it's more challenging. But it is different than vision, where, you know, they can measure like, oh, these glasses are going to correct you to 20/20. They're standard for normal.
And we actually verify that the hearing aids are doing that, where some places, like maybe a big box place, is not.
Okay.
So
And what that means is we're measuring what the output of the hearing aid is so that we know this is as close, this is the best you're going to hear with this device, you know, the best possible outcome.
Got it. Okay. If I have sudden hearing loss, it can wait until Monday.
no, we have a cell phone.
Call us.
So if it's a Saturday night, or if I fly in,
Yeah.
fly home Saturday, and something happened on the
For sure.
plane.
Yeah. Or go into urgent care at least or
Okay.
something. So, or maybe it's earwax, you know, or
Sure.
it's either eustachian tube dysfunction. So maybe you do have some fluid, but still it's better to know.
Yeah. And you just don't want to get out of that 72-hour window.
Got it.
It is a lot harder to recover if you get that far.
So if I gave you a billboard in the middle of Sioux Falls, and I said, put whatever you want on that to tell people about something important about hearing and audiology, what would it say?
Well, I would talk about dementia and wearing hearing aids and the link between it. And I would say all of those words in that order. So you'd be so confused. No, just kidding.
And you'd actually crash your car by reading it.
Oh, look, there's our TV saying it. Something
There you
about
go.
dimension. No, see, I would say that, and then Libby would come up with the same.
I just
Okay.
think that when, you know, cognition, we used to think the biggest consequence of hearing loss was just social isolation.
Okay.
We used to think that. Now we know it is far more than that. We're talking overall health. You know, we're talking about fall risk. We're talking about cognitive decline. You know, and we have evidence that this was anecdotal for a long time. Now we have a lot of really strong evidence about how treating hearing loss is one of the only modifiable risk factors for dementia.
Okay.
Meaning, you know, genetics, diabetes, all these things you don't really have power over. You can't, it's not modifiable. You can't reduce your risk. By treating hearing loss, you're reducing it back to nothing for
'cause we're
No one's
tricking-
going to read that
basically-
billboard. It's way
No.
too long.
So we're basically tricking your brain into hearing normally.
Yeah.
So then even if your hearing gets worse, then your brain still thinks that you hear normal.
So I would say maybe the slogan would be like, worried about dad? Call us.
Oh,
Okay.
Dad?
Like their dad.
I
or
couldn't
your
hear you
parents,
there.
You know?
I thought you said dad.
Worry about dad.
I thought that was another young kid saying, worried about
this is-
dad.
You need to switch languages.
This is another funny thing that we
interpreter.
have thought we should do as advertising, though, where it's like, has your loved one been kicked out of other places or like difficult patients? You know, remember how we're like, has your dad been dismissed from healthcare? Because we have,
because we take all of the hard
everybody.
patients.
If you're
Yeah.
a little fruity, come visit us. I mean, we don't.
Yes, because
we love the people that are
and
strange.
it's because people are kind of upset
Sure.
about hearing aids.
Absolutely.
And like if they haven't heard before at other places.
Yeah.
It is. It's super
We're not afraid
frustrating.
of grouchy
Yeah.
people.
We're not afraid.
Because
Like,
anybody'd be grouchy if they can't communicate.
Right.
right.
you
So
know.
we'll take anybody is what she's
Yeah.
saying.
So our joke is always, because we'll have patients
I
who
was like, no, I don't know. What is
they
this?
seem to be like the
Getting that
first time we
dementia.
meet them, they're like Mr. Grouchy Pants, right? They are,
Oh, and then they're so happy.
and then they're just so happy because you actually helped them and they
And
thought
then they refer
couldn't be.
people
Right.
because,
Yeah. So we always laugh that like if you have never had success somewhere else, come see us. We'll get you taken care of.
So how
we'd
can people
make it way
find
more
you?
funny.
Where do we call? What's your website? Where are you located?
So our office number is 605-306-5756.
And our and our website is SiouxFallsHearing.com. We're by Tinner's Restaurant on Minnesota and 69th.
Absolutely.
And-
And we love it when people stop by too.
And by the Great Life. So if you drop $20, you
Yes.
don't need
And
it. You
Yep.
can
Right
swing
now
by.
for a limited time.
With
right,
a gym
so-
membership.
There you go. So if you are interested, or if you haven't had your baseline yet, we'll make sure to put a link to the in the show notes below. So if you're watching on YouTube, just click on the description, and you can find Melissa and Libby, Dr. Libby Benson, and Melissa Baker, Master of Audiology, in the show notes below.
So
and
many
we'll also
masters.
make sure we link to the pie lady because
Yes,
everybody needs
pie
more
lady.
pie.
Ooh,
Yep.
We need pie.
Okay.
It's
She'll
good.
love it.
So good.
Thank you so much.
Thank
Perfect.
you.
Thank
Thanks
you.
for having us.
Hey, that's our show. If someone came to mind while you were listening to this, if you thought, hey, my sister needs to hear this, or I should send this to my mom, or my buddy would get a lot out of this, please share it with them. Just hit the share button and send it their way. You never know what one conversation, one episode, or one piece of information can do for someone who's been looking for answers. And if you haven't subscribed yet, please do it now. It takes 2 seconds, it's free, and it means you won't miss an episode. We've got incredible stuff coming up, and I don't want you to miss any of it. And if you're a health or wellness provider and you want to be on the show, we'd love to hear from you. There's a link in the show notes to get in touch. We're always looking for people doing interesting work who want to share what they know. And one last thing, I get asked all the time about the products and brands I actually use, so I put together a list of sponsors and favorite products that have worked for me and my family. If you're curious, that link is in the show notes too. Thank you for being here, and I really mean that. I'm Melissa Goodwin. The line is open. See you next time.